Darin Selnick, Senior Veterans Affairs Advisor for the Concerned Veterans of America.
Chairman Isaacson, Ranking Member Blumenthal, and members of the committee, I appreciate the opportunity to testify at today's hearing on the implementation and future of the Veterans Choice Program, and thank you for your leadership in ensuring that veterans get the quality health care they deserve. Today, true choice in veterans health care remains out of reach for most veterans. Like a mirage in the desert, as you move closer, it recedes into the horizon. Our assessment is that the Choice Program has been unsuccessful and is not a long-term solution. As such, we have developed recommendations for comprehensive reform through the Fixing Veterans Health Care Task Force. The current rules pertaining to choice do not represent real choice. Instead, they require veterans to obtain approval from VA before they are able to make a choice. Veterans should not have to ask for permission to select their health care provider. VA implementation of the Choice Program has been a failure. For example, the Associated Press reported, GAO says veterans' health care costs are high risk for taxpayers. The number of medical appointments that take longer than 90 days to complete doubled, and that only 37,000 medical appointments have been made through April 11th. Last fall, CVA commissioned a national poll of veterans. The results showed 90% favored efforts to reform veterans' health care, 88% said eligible veterans should be given the choice to receive medical care from any source they choose, 77% said they want more choices even if it involved higher out-of-pocket costs. Choice and competition are the bedrock of today's healthcare system. We choose our healthcare insurance provider and primary care physician. Healthcare organizations provide quality and convenient care because they know if they don't, they will lose their patients to someone else. In order to fix the VA healthcare system, both choice and competition must be injected into the system. VA recognized this when they said, evaluate options for a potential reorganization that puts the veteran in control of how, when, and where they wish to be served. Unfortunately, veterans do not have that control and will not under the current VA healthcare system. VA needs to have a 2015 healthcare system. We believe the Veterans Independence Act is a roadmap and solution to do just that. This roadmap was developed by the Fixing Veterans Healthcare Task Force, co-chaired by Dr. Bill Frist, former Senate Majority Leader, Jim Marshall, former Congressman from Georgia, Ovik Roy of the Manhattan Institute, and Dr. Mike Cussman, former VHA Undersecretary. We developed 10 veteran-centric core principles that serve as the guiding foundation. These key principles included, the veteran must come first, not the VA. Veterans should be able to choose where to get their health care, refocus on and prioritize veterans with service-connected disabilities and specialized needs. VA should be improved and thereby preserved. Grandfather the current enrollees, and VHA needs accountability. To implement these principles, we laid out 3 major categories of reform and 9 policy recommendations. First, restructure the VHA as an independent, government-chartered, nonprofit corporation, empowered to make decisions on personnel, IT, facilities, partnerships, and other priorities. Second, give veterans the option to seek private coverage with their VA funds. Third, refocus veterans' health care on those with service-connected injuries, VA's original mission. The key policy recommendations included separate the VA's payer and provider functions into separate institutions, establish the Veterans Health Insurance Program as a program office in VHA, establish the Veterans Accountable Care Organization, VACO, as a nonprofit government corporation fully separate from VA, preserve the traditional VA health benefit for enrollees who prefer it, while offering an option to seek coverage from the private sector through 3 planned choices. VetsCare Federal, full access to the VACO integrated healthcare system with no changes to benefits or cost sharing. VetsCare Choice, select any private healthcare insurance plan legally available in their state, financed through premium support payments. And VetsCare Senior, Medicare-eligible veterans can use their VA funds to defray the cost of Medicare premiums and supplemental coverage. Lastly, create a VetsCare Implementation Commission to implement the Veterans Independence Act. We retain the services of HSI to conduct the fiscal analysis. HSI determined a properly designed version of these policy recommendations is likely to be deficit neutral. In order to fix veterans' health care, we must always keep in mind what General Omar Bradley said in 1947. We are dealing with veterans, not procedures, with their problems, not ours. This is why we urge you to use the Veterans Independence Act roadmap to develop the legislative blueprint that will fix and be the future of veterans' health care. Veterans must be assured that they will be able to get the access, choice, and quality health care they deserve. In this mission, failure is not an option. We are committed to overcoming all and any obstacles that stand in the way of achieving this important mission and look forward to working with the Chairman, Ranking Member, and all members of this committee to achieve this shared mission. Thank you.
Thank you, Mr. Selnick. Let me just interject at this point. I have read, and I'm sure Richard has too, the Fixing Veterans Health Care report that your organization did, which is an outstanding report. I think it's basically it would be called Ultimate Choice. Wouldn't that be a good name for it?
Yeah, that'd be a good name.
I know in your representation of the changes are probably far more broad than some on the panel might look for us to do in terms of preserving what VA does without giving choice. But I want to commend you on that and let you know we're watching what you recommended. We're taking a look at it. We're trying to make sure Richard and I have one, or Senator Blumenthal, have one underlying principle. We're going to make veterans' choice work. I mean, it's not an option that it might work. If it doesn't work, we'll think of something else. We're going to make it work. How it works is going to take the very best ideas and input, and your organization report is one of those that's going to help us a lot, as is each of your organizations to tell us. This is going to be a process and an evolution as we go through, but one thing's for sure, we're not just hoping it's going to be over one day. We're going to make it happen one way or another.
Thank you.